This experience has been incredibly beneficial for me. Besides learning from the team and engaging in fieldwork, I have had the opportunity to meet people from different countries and interact with them. This hands-on experience has provided me with a more realistic understanding of a country's situation compared to what I could learn from books alone. It has also enhanced my knowledge and skills in dealing with public health issues, and has given me valuable insights on how to initiate and address such challenges.
This 12-year-old girl is suffering from a prolonged fever for 10 days, and the reason for it remains unknown, causing great concern from her mother. The situation could have been quickly resolved with a 15 to 20-minute dengue fever test for prompt treatment. Unfortunately, the lack of rapid diagnostic tests in hospitals led to a delayed diagnosis, which was only confirmed on the 12th day. The mosquito net used to protect the girl was discovered to have a hole. This oversight posed a risk not only to the girl, but also to other patients and villagers, potentially leading to further health complications. In Timor-Leste, similar situations are common.
When asked about dengue fever, the patient's mother expressed familiarity with the term, but lacked a clear understanding of it. In many regions, mosquito masks or nets are commonly used for isolation in cases of dengue fever and malaria. However, the facilities in place are inadequate, and the tattered mosquito net covering the patient presents a significant risk. Not only does the net protect the patient, but it also safeguards others from mosquito bites, highlighting the urgent need to address this issue. Hospitals in remote areas often accommodate the patients in a large ward, including newborns, the elderly, and those with infectious diseases. This setup poses a serious risk, especially if an outbreak of dengue fever were to occur.
Timor-Leste, listed by the United Nations as one of the world's least developed countries, faces significant economic challenges, with 30% of residents living on less than $2 a day. The region has experienced a surge in dengue fever cases since the end of 2021. Committed to providing international medical humanitarian relief, the GX Foundation, as part of its engagement with countries along the Belt and Road, initiated a dengue fever prevention pilot project. Following a visit to Timor-Leste in December, the foundation decided to donate 10 tons of materials and carry out a 9-month initiative aimed at preventing the spread of dengue fever.
The example I just mentioned reinforces the 5 aspects of our project. This includes providing mosquito-proof facilities such as mosquito nets, mosquito lamps, and flypaper to protect against vector-borne diseases, along with rapid diagnostic tests for dengue fever, and additional health promotion activities. All these components complement each other.
In Timor-Leste, where over 60% of the land is covered by forests, transportation of medical and relief supplies is a huge challenge. As a former Portuguese colony, Tetum and Portuguese are the official languages of Timor-Leste. The GX Foundation's volunteer team comprises retirees, young people, teachers, and others from Hong Kong and Macau.
Utilizing our extensive expertise, we will introduce detailed information on each epidemic prevention material, including instructions on how to use, install, and perform general maintenance. Our team will explain this information to the locals to ensure they understand the proper usage of these supplies. Once the local people receive the relief supplies, they will be able to use them immediately.
I can see that, well, they brought me here, so they're interested in understanding the culture and the language more as well. And they took their time to get to know the people, talk to them, from the driver to the Prime Minister, spend the time and make the effort to listen to them and to understand their needs.
It's completely different from our usual donations. I find it quite interesting.